You're good now, Jeff. We can
Okay,
hear you.
thank you. So good morning, everyone. I'd like to echo several of Nelson's sentiments and thank all of you for being here and for participating. This is a really special conference. For those of you who've attended before will know, and we welcome our first timers, and we will look forward to having you not be first timers for next year and for subsequent years. We're starting off the conference today with a really outstanding speaker. Tim Wang has spoken for us before and is always a pleasure to work with and always brings us great information. So for his bio, Tim is the Director of Policy and Advocacy at the Center for Education, Research, and Advocacy at Howard Brown Health, which is a federally qualified health center in Chicago, Illinois. Tim's work centers on advancing health equity for LGBTQ people, under and uninsured people, and other marginalized communities at the city, state, and national level. Tim has extensive experience in policy and advocacy work with nonprofit organizations and community health centers. Tim has previously worked on research studies funded by the Centers for Medicare and Medicaid Services and the Centers for Disease Control and Prevention. On a personal note, as I mentioned, Tim has spoken for us several times before, and I'll tell you, you're in for a great presentation. He's an expert in policy, particularly policy affecting LGBTQ individuals, and he has a great way of making that policy very approachable, very interesting, and I think most of all, always leaves us with some action steps based on that policy and changes to come. So with that, I will turn this over to Tim, and I will enjoy his presentation along with the rest of you. Tim, thank you again for joining us, and it's all yours.
Thank you so much, Jeff, for that introduction. Can everyone hear me okay? The thumbs up? Okay, great. So as Jeff said, my name is Tim. I use he, him pronouns. I'm the Director of Policy and Advocacy at Howard Brown Health, which is the largest LGBTQ community health center in Chicago. We have 12 clinical locations across Chicago, serve about 38,000 patients a year. And as Jeff mentioned, I'm here to talk about LGBTQ health advocacy in the Biden administration. So thanks so much for joining me this morning, especially if you're coming to us from the West Coast. I'm going to try and share my screen now. Let's see. All right. Can everyone see the presentation? Awesome. Okay. Great. So here's just kind of our presentation outline. So we're going to be covering federal policy updates that affect LGBTQ health, including some key policy priority areas for advocacy. I'll also be reviewing a couple of federal health officials who are really strong LGBTQ advocates themselves and members of the community, which is something that's really exciting. And then I'm going to identify some ways that health professionals like yourselves can serve as LGBTQ health advocates at the federal, state, and local level. And I've just listed a couple of topics here, SOGI data collection and LGBTQ civil rights, that I'm going to touch on that I think that providers especially can be really strong allies in terms of advocacy. So let's get started. In terms of federal policy updates, I would say the biggest federal policy update happened in January, and I'm sure you're all aware of it. The Biden-Harris administration took office, which is great in terms of a little bit of context. As Jeff had mentioned, I've been doing a federal policy update in terms of LGBTQ health at this conference now for 3 years in a row. So this is actually my first year where I don't have to do an entire presentation about the Trump administration and the terrible things that they've done over the last year. So that's personally exciting for me, but also exciting for all of us that we get to learn about some really positive policy changes that have happened while still identifying areas for growth and areas for advocacy. So in talking about federal policy updates, of course, the Biden administration on day one issued an executive order on LGBTQ non-discrimination that really follows the Bostock Supreme Court case. So I'm just going to refer to this as the Bostock executive order through the rest of this presentation. But if you are unfamiliar, the Bostock Supreme Court case was decided last year, last June, I believe, and the Supreme Court justices ruled in that case that in Title VII, the sex discrimination protections of Title VII also prohibit discrimination on the basis of sexual orientation and gender identity in the workplace. So Title VII is about employment discrimination. So this Bostock executive order kind of takes that reasoning and interpretation of sex discrimination and takes it one step further. It says that all of our federal civil rights laws that prohibit sex discrimination must be interpreted to also prohibit discrimination based on sexual orientation and gender identity. So that includes things like Title VII, of course, but also Title IX in education, the Fair Housing Act, and all of our federal civil rights laws that prohibit sex discrimination under this executive order are now also interpreted to prohibit discrimination based on sexual orientation and gender identity. So that was a huge step towards enhancing civil rights protections for LGBTQ folks in a number of arenas, like we talked about employment, education, housing. And it's not only in these big federal civil rights laws, because when government agencies, often when they issue policies or regulations on how to run their programs, et cetera, or rules, in those non-discrimination provisions in those sorts of rules, a lot of times they'll just cite existing federal civil rights legislation. So they might say like the non-discrimination provisions for this rule are the same as in Title IX, for example. So for any rules that kind of reference an existing federal civil rights law now, those rules will also now include sexual orientation, gender identity, non-discrimination provisions because of this executive order. So it's really far-reaching and a really great step in the right direction in terms of enhancing LGBTQ civil rights and non-discrimination protections. In addition to that, the Bostock executive order also directs all of our federal government agencies to review their rules and their policies and to find anything that's inconsistent with this interpretation of sex discrimination and to revise those rules and policies or rescind them as necessary. And we know that this is huge. This is really important because the Trump administration had basically the opposite interpretation of sex discrimination, in that they really thought sex discrimination specifically excluded discrimination based on sexual orientation and gender identity. And they went so far as to remove those protections from certain rules. So I think that with this executive order, the Biden administration is really attempting to kind of course correct for a lot of the harm that has been done over the last 4 years by the Trump administration in terms of their very limited view of sex discrimination, that it doesn't include sexual orientation or gender identity. But it's really not only just kind of course correcting and getting us back to like a status quo. The executive order also asks agencies to identify any additional actions that might be necessary in order to combat LGBTQ non-discrimination. So that's also a really welcome change to see. And then just touching on another really great executive order that was issued on day one, the Biden administration also issued an executive order on advancing racial equity. And this executive order really aims to kind of root out systemic racism wherever it may exist throughout the federal government. It really directs agencies to look at their programs, see where there's inequitable access to programs and services for racial ethnic minorities, and really develop actionable plans to address inequities that are affecting racial and ethnic minorities because of systemic racism. And that's really great, just on its own, because we know that as organizations that are dedicated to advancing health equity, we know that there can't be any health equity without racial justice. So this is really welcome just for that kind of lens alone. But this executive order is actually kind of even broader than advancing racial equity. It really is about advancing health equity generally for all underserved communities. And this executive order actually defines underserved communities to explicitly include LGBTQ people. So all those kind of things that I was talking about before in terms of racial ethnic minorities, directing federal agencies to review programs for inequities and developing action plans to address those inequities, that also applies to how federal agencies are serving or not serving LGBTQ communities. So it's really directing the government to look at how they're currently serving LGBTQ communities and other underserved communities and how they can enhance or improve that sort of care or service provision with the explicit directive to really engage with those communities. So engage LGBTQ communities, engage racial and ethnic minority communities to find out what those communities need and want. This executive order also launches a new, it's called the Equitable Data Working Group. So we're going to be talking, like I said before, about sexual orientation and gender identity data a little bit more later, but this kind of working group has the same kind of idea in that we really need more structured and more regular demographic data collection on race, ethnicity, on sexual orientation and gender identity, disability status, preferred language, to really understand how all these underserved communities are or are not accessing services, to understand if there are any sorts of disparities in health outcomes or program outcomes, and to really kind of track our interventions to make sure that they're working. This executive order also directs the Office of Management and Budget to report on strategies for allocating federal funding to advance equity. So I think we're likely to see over the next couple of years a few more funding opportunities in terms of research, in terms of public health interventions, in terms of health providers providing care, specifically around advancing health equity and advancing racial equity and advancing equity for LGBTQ communities. So that's welcome to see as well. And lastly, this executive order rescinds just a really terrible Trump executive order that prohibited training on systemic racism and sexism for programs that receive federal funding. So if you were at a healthcare organization that received federal funding and you stopped providing these sorts of trainings because of this executive order, it has been rescinded, and I would definitely recommend that you kind of begin that training again. So in addition to those sorts of executive orders, the Biden administration has already taken some proactive steps to rescind a couple harmful policies or just kind of like block some harmful policies. And this isn't an exhaustive list by any means, but just kind of some big ones that we even touched on in previous years. So just kind of giving an update. For the HHS grants rule, this was kind of touted in the media as being the Trump administration's kind of like parting shot against the LGBTQ community. This rule was finalized literally right as Trump was leaving office, I think maybe a week or two before he left office. And what this rule does is that it allows HHS grantees, so programs that receive federal funding from HHS, to discriminate on the basis of sexual orientation and gender identity. And we know that that is hugely problematic, given that LGBTQ folks are overrepresented in terms of people who are living below the poverty line, maybe more reliant on social service programs like those that are funded by HHS. HHS funds a huge variety of public health, healthcare providers, and social service programs that all provide critical services to folks across the country, and probably even more so over the past year. With the pandemic, we have research that shows that LGBTQ folks have been disproportionately impacted financially as a result of the pandemic. So that means like increased financial strain, more likely to have their hours cut at work or lose their jobs entirely. So with that in mind, they could also be more reliant on these sorts of social service programs that HHS grantees provide. So the last thing that they need is for a program to be able to say, I'm not going to serve you because you're gay or something like that. So luckily, the courts kind of agreed with that, and they ordered that this rule be postponed, the implementation of the rule be postponed until August 2021. So usually the case is if an HHS rule is challenged by a court, HHS will usually try and defend its own rule, go against the court to get the rule implemented. However, since we kind of shifted administrations, Biden's HHS, I don't think has any interest in seeing this rule actually implemented. They're not going to challenge the court order. They've agreed to the court order. So for now, the rule is postponed. It's set to be implemented in August 2021. But it's my understanding really that, with the Bostock executive order, HHS is going to be reviewing all of its policies to find the ones that are inconsistent with that kind of view of discrimination. I'm sure that they'll find that this HHS grants rule will really increase discrimination against LGBTQ folks, which is inconsistent with the Bostock executive order, and kind of just decide to revise or rescind that rule. All that being said, definitely something to kind of keep watching, just keep an eye on August 2021, just to make sure that this rule doesn't somehow kind of slip through the cracks and accidentally get implemented. But for now, it has been blocked by the courts, and Biden administration is going along with that court order. In terms of the Department of Housing and Urban Development, or HUD, they've already taken steps to implement the Bostock executive order. They've announced that the Fair Housing Act protects LGBTQ people from housing discrimination, which is a welcome change from the previous administration, which took the opposite stance, of course. And you may also remember that under the Trump administration, HUD had released a proposed rule that would have allowed homeless shelters to discriminate against transgender people. I don't believe that that rule was ever finalized under the Trump administration, and certainly I don't think it will be finalized under the Biden administration. So I think that that rule has just been effectively been killed. And then in terms of public charge, the public charge rule, it makes it harder for certain immigrants who use certain government assistance programs to get citizenship. But I know that at Howard Brown, and I'm sure that for a lot of you at your healthcare organizations, we've had to do a lot of outreach and education work with the immigrant communities that we serve in partnership with immigrant advocacy organizations and community organizations, just to do a lot of education about what the public charge rule actually is. Because it doesn't affect all immigrants and it doesn't count all government services or all federally funded services as a public charge against citizenship. But given the intense anti-immigrant sentiment of the previous administration, and also the previous administration's lack of education or awareness that they did around the public charge rule, it's very understandable why communities would have issues or concerns about this rule or not really understand it fully. So I think that just the rule itself, even though it doesn't apply to all immigrants or apply to all services, it really had this terrible chilling effect for immigrant communities in terms of them seeking care, because they were afraid that it would count against them or count against their families who are trying to seek citizenship. So I think that that rule has been hugely harmful. It's been challenged in the courts, but pending a legal decision, the Biden administration has announced that it's not going to enforce this rule anymore, which is really great. And then lastly, in terms of the Affordable Care Act, Section 1557 is the non-discrimination provision of the Affordable Care Act, and it's been through a lot in terms of legal challenges and lawsuits. Both, Obama's rule has been challenged in the courts, Trump's final rule has been challenged in the courts, the ACA as a whole has been challenged in the courts. But in terms of looking at the harmful policies, Trump's final Section 1557 rule it removed the explicit gender identity non-discrimination provisions, as well as the sex stereotyping non-discrimination provisions that were put in by the Obama administration. And that really kind of gave a lot of really necessary non-discrimination protections, especially for trans folks in accessing healthcare, because we know that anti-trans, anti-LGBT, LGBTQ discrimination in healthcare is sadly still all too common. So that rule, was like I said, challenged in the courts, and it has been enjoined by the courts, and the Biden administration is not going to challenge those sorts of rulings. So, and then I also just wanted to quickly touch on some new LGBTQ allies, members of the community, really strong LGBTQ advocates themselves that we have working in the administration now. I think these people will be really vital partners to all of the health equity work that we're trying to do over the next the next presidential term, however long that may be. So I, of course, would be remiss if I did not mention Dr. Rachel Levine, who is the first out transgender person to be confirmed by the Senate for a federal appointment. And she is our new Assistant Secretary of Health in the Department of Health and Human Services. Dr. Levine is a pediatrician by trade, was most recently the Secretary of Health in Pennsylvania. So she was kind of leading that state's response to the COVID pandemic when she was tapped to be the Assistant Secretary of Health. She has a wide-ranging expertise, including expertise in adolescent health, LGBTQ and trans health, eating disorder treatment, substance use disorder treatment. So I think that overall, she's a wealth of knowledge, will be great for the American people as our Assistant Secretary of Health in HHS. But also, she's a member of the community, a strong LGBTQ advocate herself. And being so close to the top of HHS, I think will be a really valuable ally in any of the work that we're trying to accomplish in terms of health equity, where HHS really plays a strong role in our federal government. So some other names that I think maybe some of you might even recognize that will be really important in terms of reaching out to for advocacy reasons. Reggie Greer is the White House Senior Advisor on LGBTQ plus issues. Laura Durso, who, if you came to this talk last year, Laura Durso and I kind of gave this talk together. And Laura at the time was working at Whitman Walker Health Center in DC and has since moved on to working with the Biden administration. So she is the chief of staff in the Office of Civil Rights at HHS, which is another great place to have such a strong LGBTQ advocate. The Office of Civil Rights is where they hear any sorts of discrimination complaints. And we know that, that's been an issue, especially, over the last 4 years with a lot of kind of conscience-based kind of discrimination. So I think it's really important for us to have a strong LGBTQ advocate in that office. So Laura is situated really nicely and is, really great to work with. And if any of you saw her present last year, you know that she's a really strong ally and advocate herself. And then Megan Maury is another colleague and name that might be familiar to many. She was the policy director at the National LGBTQ Task Force. And she was really an expert in terms of data collection, data advocacy. She did a lot of work trying to get more sexual orientation, gender identity data questions added to federal surveys, data surveillance systems, and the census. And she is now the senior advisor at the US Census Bureau, so perfect fit for her. And we could really see a lot of advancement in terms of data advocacy, which again, we're going to talk about a little bit more later on. And so one thing that I just want to kind of underscore here is that it's a very different kind of health policy field that we're in now with this administration shift. I think over the last 4 years, really we were kind of in defense mode. We're really trying to hold on to any progress that we made under the Obama era, try not to lose too much of that, and also at the same time really trying to defend against all these terrible policies that were coming at us that were really harmful for LGBTQ communities. But as I've kind of covered, the Biden administration has taken a lot of steps already to kind of course correct a lot of those terrible policies, terrible actions, to get us back to a place where it's kind of, we're hoping to get back to kind of an Obama era like status quo after the review and the Bostock executive orders, and we kind of rescind all those horrible policies that were enacted by the Trump administration. But we also have really strong allies in the administration, and I think this is also a good time for us to really push for more progressive change, more progress than we've been able to for the last 4 years. So that's something that's really exciting in terms of health policy, LGBTQ health policy, especially right now. So I just wanted to reference this document. So I worked with folks from, all of these organizations that are, great organizations, LGBTQ health centers, LGBTQ advocacy organizations from across the country, to put together a document called Next Steps for Building Better LGBTQI, including Intersex Health. And in this document, we kind of came together to brainstorm a list of policy priority areas and actions that the Biden-Harris administration could take to really take steps to advance LGBTQI health equity, not just kind of get us back to a status quo place. And so it covers a lot of different topics, but I kind of went through and pulled out ones that were directly relevant to provision of healthcare, because I know all of you are members of our healthcare workforce. So I've presented those here. So in terms of COVID-19, I think this is top of mind for all of us on this call presentation. And I think one thing that is a constant advocacy need for all of us is to ensure equitable allocation of COVID-19 resources, relief services, vaccines now, to the underserved minority populations, especially Black and Brown communities that have been impacted hardest by the COVID pandemic. But I think along with that, we really have a strong call for improving data collection, especially sexual orientation and gender identity data collection, related to the COVID-19 pandemic, just so that we can better understand how the pandemic has affected our community. So really increase SOGI data collection in COVID health outcomes, COVID testing, vaccine access would all be incredibly helpful for us to better understand how LGBTQ people have been impacted by by the pandemic are recovering from the pandemic, hopefully. It'll also help to ensure that LGBTQ people and other underserved communities are actually accessing the financial and social support services that are afforded to them by the American Rescue Plan Act. And then I know that we've already talked a little bit about the Affordable Care Act, but pending any of the many legislation, legal things that are happening with the ACA, we are really trying to advocate for kind of a stronger rule in terms of 1557, not just going back to Obama's 1557 rule, but a new rule that really fully incorporates the Bostock decision. Like I had mentioned previously, the Obama era Section 1557 rule explicitly prohibits discrimination on the basis of gender identity, but it doesn't explicitly prohibit discrimination on the basis of sexual orientation. It does explicitly prohibit discrimination based on sex stereotyping, which certainly does cover some forms of sexual orientation discrimination. For example, if it's a sex stereotype that men only are in relationships with women, and then you discriminate against someone based on that belief, that could be like a form of sexual orientation discrimination that's covered under this sort of umbrella of sex stereotyping. But with Bostock explicitly calling out sexual orientation, I think a stronger new 1557 rule would just explicitly prohibit discrimination on the basis of both gender identity and sexual orientation, and then also add in non-discrimination protections on the basis of sex characteristics and intersex traits. And also to be sure to restore the sexual orientation, gender identity, non-discrimination provisions to any other regulations, a bunch of CMS and HHS regulations that it was removed from as a result of Trump's final 1557 rule. In terms of the Centers for Medicare and Medicaid Services, I think this is a place where we can kind of advocate more for national coverage determination for gender affirming care, not just surgery, but also, hormone treatment, puberty blockers, anything in that kind of spectrum of gender affirming care, and really to emphasize the importance of non-discrimination, especially in working with trans folks in the Medicare and Medicaid policy manuals. In terms of intersex health, I think, like everything that we've been kind of saying before, data collection is key. So really increasing data collection and also focusing on programs to reduce disparities experienced by intersex folks, as well as regulation, mandate, or some sort of policy to delay any sort of non-essential and irreversible surgeries that are traditionally performed on intersex babies, to kind of delay that until these individuals are old enough to meaningfully participate in the decision-making process themselves. It's really about, bodily and patient autonomy. And then in terms of conversion therapy, we'd love to see some sort of policy or regulation that bars federal funding from going to organizations that perform conversion therapy or refer to conversion therapy, especially for LGBTQ minors. There's absolutely no research that shows that conversion therapy actually works for its intended purpose. And there's tons of research that shows that conversion therapy is extremely harmful. So we'd love to see some sort of regulation that stops federal funding from going to fund conversion therapy and stops our taxpayer dollars from being used to do conversion therapy. So that was kind of our quick federal policy update and overview. So now I wanted to definitely kind of jump into more of the kind of action-oriented steps, things that you can do, especially as healthcare providers. I think that the two areas here are certainly not the only areas of LGBTQ health advocacy that you can be involved in, but I think that providers in particular have a really strong voice in terms of advocating for data collection and advocating for LGBTQ civil rights. So I'm just going to talk about these topics a little bit, and then I'll get into more specific action steps at the end. So in terms of sexual orientation and gender identity data collection, I know that I may be kind of preaching to the choir here with this, but I think that SOGI data collection, systematic and regular SOGI data collection, is really necessary in order to understand and address LGBTQ health disparities at the population level. So we know that LGBTQ health disparities exist from research studies, the scientific literature. We also know that there are some interventions that have been proven to be effective, again, from research and scientific literature, but really to understand understand LGBTQ health disparities and track interventions effectively at the population level in real time, we need regular and systematic SOGI data collection in federal and state surveys, in our federal data surveillance systems, and also in electronic health records. I think sexual orientation and gender identity data in electronic health records helps us to provide the best quality of care, patient-centered care for all of our patients. So for example, SOGI data helps us at Howard Brown make sure that we are always using the correct name and correct pronouns for every patient for, whenever we address any patient. So both in terms of like in-person kind of communication as well as, written communication. It also helps us in terms of targeted quality improvement within our organization and clinical decision support. So SOGI data is really useful for us in terms of referring our patients to services that are relevant and necessary for them. So perhaps it might be referring a patient to one of our LGBTQ specific behavioral health support groups. It's really useful for that. It's really useful for conducting relevant sexual histories, and in tandem with that, kind of providing counseling around STI and HIV prevention. It's also really helpful in terms of providing the correct, the correct preventative healthcare screenings. For example, if a transgender man goes to a healthcare organization that's not collecting any sort of gender identity data, the providers at that organization may not even realize that that patient is transgender. And so they may not realize that that patient also may have a need for cervical cancer screenings. So it's really about knowing our patients and that informing how we can provide the best quality of care for them and also create affirming and safe spaces for them to be in. And I think that this is something that's not new to a lot of healthcare organizations. A lot of healthcare organizations are already using their demographic data in terms of race, ethnicity, or income, for example, to understand how they're reaching racial ethnic minority patients or low-income patients and what they can do to improve care for those populations. So it's the same with sexual orientation, gender identity data in terms of being able to really see your LGBTQ patients and provide the best quality of care for them. And like I was saying before, I think that hospitals and healthcare providers especially are really strong allies in the fight for SOGI data collection, because I think a really common concern that gets brought up when folks are advocating for increased data collection is that SOGI data collection will just be too hard or too expensive, too time consuming, or too awkward for large hospital systems to undertake. So I think to whatever degree is possible as healthcare providers, for you all to kind of stand up together and say, this may be difficult, but it's not something that we haven't done before. It's really in line with our mission to provide the best quality of care for patients. This is something that we understand is important. Even if it may be hard, we're committed to this. I think that sort of lends a really strong kind of impact behind this sort of advocacy push. I think is an area where providers have a really strong voice. And then also in terms of another kind of area where I think providers have a really strong voice is kind of LGBTQ civil rights. So I'm going to be talking about kind of two things within this sphere. We'll be talking about the Equality Act, and then we'll also be talking about this recent surge of anti-transgender legislation that we've been seeing in states across the country. So to start with the Equality Act, I'm sure many of you already, you've heard of the Equality Act, you know the Equality Act. I think this map is a really great example of why we need the Equality Act. So this is a map that's created by the Movement Advancement Project. If you're not familiar with them, I would definitely recommend checking out their website. They have a lot of different interactive maps for different categories of things. So this map is looking at non-discrimination policies that include sexual orientation and gender identity, and this is in public accommodations. So like I was saying, they have separate maps for like employment and housing and other areas. So as you can see from this map, in the dark green are the states that have laws that explicitly prohibit discrimination based on sexual orientation and gender identity. So that's currently 21 states in DC. And then in contrast, this more kind of gray, beigey color, those are the states that don't have any explicit protections on the basis of sexual orientation, gender identity in public accommodations. So that's 23 states and the 5 territories. So I think really from this map, you can see, you might be in one state and you might be protected. You might be able to, go have lunch at a restaurant, or go to a movie theater, or go to a hospital, free from discrimination if you're LGBTQ. And then you kind of cross the border and those protections don't exist. So it's really kind of a patchwork of protections for LGBTQ folks at the moment across the country. So the Equality Act really aims to address that by amending all of our existing civil rights laws to explicitly include sexual orientation and gender identity. So it's consistent across the board for the entire country. And I think even just saying that, that might sound a little bit familiar. I think maybe some of you might be thinking, that sounds exactly like what you just said for the Bostock executive order. Is the Equality Act even, is it still necessary now that we have this Bostock executive order and now that we have a supportive administration? And the answer is yes. And I think it's for a couple reasons. Like I was saying before, the Bostock decision really applies to our federal non-discrimination laws that include prohibitions on sex discrimination, because it's really about how you interpret sex discrimination, right? It's about does sex discrimination include sexual orientation, gender identity, or does it not? So for the Bostock executive order, they interpret it to include sexual orientation, gender identity, but that's only for the federal civil rights laws that already include a sex discrimination provision. And believe it or not, there are actually a couple federal civil rights laws that don't include sex discrimination. So the Bostock law wouldn't apply there. Whereas for the Equality Act just goes ahead and adds sexual orientation and gender identity, directly to each of our existing civil rights laws, whether or not sex discrimination is included or not. So that would provide LGBTQ non-discrimination protections across a wide, every aspect basically of our lives in terms of housing, public accommodations, employment, I think like jury duty, credit, education. So I think that's one big difference in why the Equality Act is still necessary. I think another big difference is that, of course, passing the Equality Act would give us lasting and consistent protections across the country, with emphasis on lasting. I think throughout this presentation, I think one thing that's been clear is that with executive orders, those things can change depending on who is in office. We had an administration that had completely opposite views, for the previous 4 years, and we saw, what kind of havoc they were able to wreak with, executive orders. And now switching to the Biden administration, they're trying to course correct with their executive orders, but you never know in the future if we have another administration that's not friendly towards LGBTQ people, they can go ahead and reverse those executive orders again. Whereas with a law like the Equality Act, it's much more difficult to kind of go ahead and change a law. And then one other thing that I'll just mention is that there are some people that kind of think, oh, it's 2021. And is the Equality Act even still necessary? Like the general public really seems to support LGBTQ folks, and we have Pose on TV, and Pose is great, but unfortunately, non-discrimination, discrimination against LGBTQ folks is still unfortunately more widespread than a lot of people might think. So there was a Center for American Progress survey in 2020 that found that 1 in 3 LGBTQ Americans and 3 in 5 transgender Americans had experienced at least one instance of discrimination within the past year. And we know that discrimination has effects on both seeking healthcare, and also just the discrimination itself can have effects on physical and mental health. So we definitely still need the Equality Act. And the one thing that is true about that previous statement is that the Equality Act is widely supported by the general public. I think it's like something like 70 or 71% of the American public support legislation like the Equality Act, and that includes a majority of self-identified Republican Americans, Independent Americans, and Democrat Americans who all say that they support the Equality Act. There's also a huge coalition, I think it's over 300 businesses that are operating in all 50 states that all support the Equality Act as well. So, this legislation is actually hugely popular with the American public. And so, it has passed the House this session, and it's passed the House for the second time, actually. But now it's in the Senate, and that's kind of where it's going to face a bit of an uphill battle. We know that we have a slim majority in the Senate with Vice President Harris's tie-breaking vote. So we do not have the filibuster-proof 60 votes that would be necessary to kind of just pass something. So in terms of getting this passed in the Senate, it will require switching some Republican senators who may not be in support of the Equality Act to support the Equality Act. So we'll kind of talk about maybe some ways that providers can get involved in that fight. And then I definitely wanted to spend some time mentioning this absolute surge that we've been seeing of anti-trans state legislation this year. I think the last I checked, it was like over 90 or maybe even over 100 anti-trans bills that have been introduced in states across the country this own. The majority of these bills fall into like one of these two categories that I've laid out here, sports bills or healthcare bills. So in terms of these sports bills, this is definitely the most common that we've seen this year, and I'm sure many of you have heard a lot about them. These bills would prevent trans youth, predominantly trans girls, from participating on girls' sports teams. And depending on the bill in the state, it ranges from even like elementary school like sports teams all the way up to like collegiate sports. And bills like these have been introduced in at least 31 states. This number keeps growing, unfortunately. And this year, these bills have been passed in 3 states, in Mississippi, Arkansas, and Tennessee. A bill like this was not passed in South Dakota, but the governor went ahead and signed a couple executive orders that essentially does the same thing. And then last year in Iowa was the first state to actually pass an anti-trans sports bill into law. They did it last year, kind of right before, everything shut down with the pandemic. And thankfully that year, that law in Iowa has been stopped by the courts. But this is something that has just been growing and growing. It's becoming more and more popular in states across the country. And unfortunately has been moving forward in a lot of states across the country. And I think, so proponents of these sorts of bills kind of argue that, transgender girls shouldn't be allowed to participate in sports against cisgender girls because they have some sort of innate or biological advantage. It would lead to transgender girls, dominating women's sports and taking all of the scholarships. It would undermine fairness in women's sports. So that's kind of the argument that these bills are based off of. And I think that the biggest issue with that argument is that it's not based on any sort of evidence. These bills are bills that are kind of designed like chasing a problem instead of addressing a problem. Like the problem that they're meant to address doesn't actually exist. And that's very clear in terms of there's been some media coverage and interviews with elected officials who are the lead sponsors of these bills or who support these bills in states like Mississippi, Arkansas, and Tennessee. And, when asked for if they know of any trans athletes in the state that are, dominating their fields, or if they even know of any trans athletes, period, that are participating in sports in the state. Many times the people who support these bills and who wrote these bills say no, like they don't know of this happening at all in the state, and really that they're kind of enacting this legislation, preemptively, thinking that this will be a problem if they don't enact this sort of legislation. So I think that that's not like how legislation should be enacted. And these laws are kind of chasing a problem that doesn't exist, but at the same time, these laws create very real problems for transgender students, especially trans girls, who already experience a lot of discrimination in school settings, and who probably, just want to play on a sports team with their friends. Participating in school sports does have a lot of benefits in terms of social, mental, and physical well-being that trans students should be allowed to participate in fully. And another really problematic aspect of these sorts of bills is that, because they don't really have any sort of scientific or even really anecdotal evidence to go off of, they really rely on a lot of transphobic myths that are often kind of peddled by right-wing conservative anti-LGBTQ groups who the same groups that are always the ones that are funding the campaigns behind these sorts of legislation. And they kind of say if we don't have a bill like this in place, then cisgender men will pretend to be transgender women so that they can, dominate women's sports. But the issue with those sorts of claims is that first, they're completely baseless, and then second, they really minimize the experience that transgender people have in terms of accessing medical gender affirmation, accessing social affirmation, and the struggles that they go through are really trivialized by that sort of argument. And it also really perpetuates transphobic myths that trans people are deceptive or that they're lying about their identities. And we know that that sort of myth is underlying a lot of the hate violence that disproportionately affects transgender people, especially Black and brown transgender women. So perpetuating that sort of myth in legislation is definitely going to be harmful to the trans community, and it's a lot bigger than just kind of participating in sports, even though that in itself is also harmful. And then this kind of other bucket that we've been seeing a lot more of is healthcare bills. So these bills would criminalize the provision of gender affirming care to transgender youth. So really the criminal penalty kind of varies. It varies a lot actually, depending on, the state and the bill, but it can range from, a fine all the way up to, I think some states consider it a charge of like child abuse, and you could get jail time for providing gender affirming care to trans youth. And really, it's going to already put even higher barriers for trans youth to access healthcare if these sorts of services are criminalized. So healthcare bills like these have been introduced in at least 20, I think maybe now 21 states. And Arkansas actually very recently, a couple weeks ago, became the first state in the country to pass one of these sorts of bills into law. The Arkansas General Assembly actually overrode the governor's veto to pass this law. So they really wanted it to be a thing. And these laws are problematic for a number of reasons. One, because they really ignore scientific evidence and the recommendations of healthcare providers like yourselves and professional healthcare associations that all agree that gender affirming care really is life-saving. We know that from research, gender affirming care for trans folks can improve physical health, but also especially mental health. It can reduce depression, anxiety, reduce suicidality. So quite literally, gender affirming care is life-saving, medically necessary care. And so criminalizing the provision of this care is really going to be dangerous for trans youth who really need access to those services. I think that these bills also really mischaracterize what gender affirming care even is, and it ignores, the years of best practices that we have available in terms of how we should be providing this care. A lot of folks who are proponents of these sorts of bills kind of characterize gender affirming care as, haphazard surgeries that are performed on children who don't know any better, who aren't informed about their decisions, when we know that couldn't be further from the case. Surgery is, first off, is never the first step in gender affirming care. And, for best practices in terms of gender affirming care, it builds in a lot of time, a lot of energy for both the patient and provider to kind of sit down with each other, consult each other, and really discuss each avenue of gender affirming care, what the benefits might be, what the side effects might be, so that the patients are really fully informed and can make the best decisions for themselves with the support of their families and providers. So that's not the picture that these bills are painting. And again, the sort of picture that these bills are painting is just completely inaccurate and also transphobic and really problematic, especially for healthcare providers. So now I just want to kind of talk quickly about some ways that folks can get involved if you feel like you'd like to be more involved in any of these sorts of causes. In terms of SOGI data collection, I think if your organization is not currently collecting SOGI data, I'd love for you to become a SOGI data champion within your healthcare organization. I think that it is something that can seem like a very overwhelming and daunting task. It can seem difficult. There are some implementation challenges that you'll have to consider. So usually the first step in an organization adopting SOGI data collection is that there's a really strong champion or a strong group of people that are constantly moving this forward, constantly bringing it up with management. And that's really one of the best ways to kind of get this through a healthcare organization. Luckily, there's a lot of help available in terms of folks that want to start doing SOGI data collection within their healthcare organizations. You can always consult your local LGBTQ groups, but there's lots of technical assistance centers, especially from LGBTQ focused healthcare organizations. Howard Brown provides technical assistance, for example. And I think it also would be great for you all to kind of go back and work with your hospital associations or professional associations to kind of share any SOGI data training or resources that you found helpful so that other hospitals that you're associated with can also begin kind of doing this work. So one quick resource that I linked there is from the LGBTQIA Health Education Center, a program of Family Health. They have a whole suite of policy briefs, publications, webinars, and trainings that are specifically about collecting sexual orientation, gender identity data in healthcare settings. So I think that's a great place to start. In terms of the Equality Act, like I said, we do need to flip a couple of Republican senators. So if any of you are in states that do have Republican senators, or if you're not sure if your senator supports the Equality Act, it can't hurt to give them a call to see where they stand on that. Again, I think healthcare providers can speak from a really moving perspective in how discrimination affects health outcomes for people, and really drawing that connection is something that providers are great at doing, especially if you can kind of come together with the other providers at your organization, or maybe submit a letter together with other hospitals, can provide, again, a really strong voice in calling for the Equality Act. And then in terms of this anti-trans legislation that we're seeing, I actually saw this call to action from GLMA and the National Center for Trans Equality yesterday. So I was like, oh, great, I'm just gonna pop that in there. So they've created a sign-on letter for providers. So it's for anyone who provides healthcare, including behavioral health providers, nurses. They also welcome sign-on from students or residents who are providing care to folks. And it's just a letter that really says, we are medical providers and we do not agree with these sorts of laws. They undermine the medical profession. They undermine our ability to provide the best quality of care for our patients. And then what they're going to kind of do with this, collect signatures on a rolling basis. And then when a state introduces legislation like that, they'll kind of go to their database of signatures, and maybe they'll pull the ones from that state and send them off to state advocacy organizations that are really pushing against these sorts of bills. So I think that this is a great way that providers can make their voices heard in a pretty easy way. So I have a link there, but it's also on GLMA's like social media. So I found this on Facebook, but I think it's also like on Twitter and Instagram. And also, I think in terms of the anti-trans legislation, really good to kind of just track the bills that are going on in your state. So I know Freedom for All Americans, Trans Equality, ACLU, they all have different trackers where you can kind of go to your state and it'll show you all the anti-trans and anti-LGBTQ bills that are currently being considered. And they also kind of track where they are in the process. And sometimes they'll also provide you with some action alerts where you can just kind of click a button and submit a quick letter to your legislators. So I definitely recommend kind of checking those out. And especially for the anti-trans kind of healthcare bills, if there is a bill like that that's being considered in your state, kind of banding together with the other healthcare providers, the other hospitals in your state to submit a letter, to call your legislators is also something that's really powerful because it really affects your work specifically as healthcare providers. So how am I doing on time? Okay, so we've gotten to the end here, and I wanted to make sure I left a couple minutes for any questions, and that's also my email address. So please feel free to email me with any sort of follow-up questions. But if we have any questions, I'd love to take some questions now.
Tim, I'm going through the chat here. There are a couple of great questions. There's one in particular I wanted to find. How do you think, in your opinion, how do you think that coming restrictions on state voting rights will impact the LGBT community?
Yeah, so I think that in terms of state voting rights or anything where we're looking at political representation for marginalized communities, it's going to impact LGBTQ rights because, a lot of those state kind of voting rights or voting restriction laws are really skewed towards, one way. They're really kind of skewed towards more conservative leaning, more Republican, kind of ensuring that kind of representation in the federal government and state government. and kind of boosting or overrepresenting those sorts of views. And we know that, traditionally those kinds of views have also been views that are contrary to LGBTQ rights. So I think that that's a really great example of why we need to really be allied with other social justice movements, all with the same goal of ensuring health equity for all marginalized populations.
Great, thank you. What are some good ways that we can stay updated about current LGBTQ health policy priorities? Obviously this is a rapidly changing field.
Mm-hmm. Yeah. Let me just, okay. Yeah. Thank you for that question. Yeah, I think that there are a couple of sites that I definitely like frequent every day just to kind of catch up on things. So generally, I think ACLU, Lambda Legal, and Equality, they all have their own like state organizations. So definitely checking in with those folks or looking at their website regularly. I find that those are usually updated pretty regularly, and also for sure for ACLU. They usually have really actionable action items for any sorts of kind of like anti-trans legislation or anything else that might come up. So I think those are good places to start. And then I would also recommend just kind of looking to see if there are any like LGBTQ health centers or LGBTQ community centers in your state or in your area, and kind of connecting with them, because I think that they can provide a really helpful lens in terms of any sort of anti-LGBTQ activity that's going on more locally. So I know that Centerlink has like a database that you can kind of search by location to find LGBTQ community centers that are in your area. And I think connecting with them would be a great way to stay updated about LGBTQ specific policy, especially locally. And then, like I mentioned, some of the other like national organizations like ACLU and Lambda Legal are also really great to stay connected for bigger picture things.
Great, thank
Tim,
you.
may I ask you a direct question here?
Sure.
Okay, great. Right now in Puerto Rico, we're dealing with government officials that want to prohibit gender affirming therapies. Could you share some of the strategies that are being used in the states that have the same situation to revert those stupid, because they cannot be called in any other way,
Yeah.
public policy actions?
Yeah. So I think that one thing that's really helpful in terms of especially the medical kind of bans that we've been seeing that's really helpful is like media involvement. I think these stories have a really strong media angle to them just because they involve generally the provision of care to children, and it's life-saving care. And these bills really could have a catastrophic effect for trans youth. And a lot of media outlets will kind of run stories about that. And that sort of helps to build up a lot of pressure, especially on elected officials who are kind of, afraid of a lot of media backlash, or afraid of public opinion swinging against them. I think that was probably a big reason, why the governor in Arkansas decided to veto the medical care ban. I think that governor was afraid of, there was already a ton of media coverage of it, was afraid of a lot of backlash. I don't know if you might remember a couple years ago, we saw a similar rise in anti-trans legislation that was mostly around like use of public bathrooms and other public accommodations. North Carolina passed one of those laws and then received a ton of backlash. There was lots of even economic analysis about the billions of dollars that they lost in terms of businesses because of that bill. So I think that if you can drum up a lot of like media attention, there's the chance that people will kind of back off out of fear of that sort of backlash. I think we also saw that there was a bill in Florida that would have allowed really disgusting and invasive kind of like checks or verification checks to see biological sex. That also, there was lots of backlash against that, and that kind of killed that bill in the Senate, hopefully. So I think that definitely reaching out, maybe doing like an op-ed or sending a letter to the editor could be really helpful. And definitely if you wanted to kind of check out that sort of just like form letter that was linked in the, I think I can go back. Yeah, that sort of link kind of just links to a general letter that has some sort of statistics about gender affirming care that you can kind of pull from to kind of write your own letter or op-ed. And I think it's also valuable to kind of work with your colleagues. So if you can kind of get a group together of all the hospitals or healthcare providers, as many as possible, a sign-on letter perhaps, I think that's also really effective.
Thank you.
Sure.
So
Thank you for your question.
Tim, we have another question. How can physicians best advocate for healthcare rights for their trans youth, particularly in states that are trying to block access to appropriate health care?
Yeah. So I think that that's definitely something, in addition to any of the stuff that I had mentioned previously, I think for healthcare bans specifically, healthcare providers, you have a very strong voice because these bills, they affect you, they affect the work that you can do. And I think, just kind of looking at what the Arkansas governor had said in terms of why he decided to kind of veto that bill, even though it eventually was enacted, was because he didn't think that the government should be involved in telling healthcare providers what they should do to best serve their patients. So I think definitely if there are those sorts of bills that are like being advanced in your states, I'm sure that the ACLU or the equality in your state is kind of organizing against that. I would definitely check in with them. It's really powerful for providers to provide their own personal testimony and their own personal stories. So if you have the time and ability, I think volunteering with one of those organizations to kind of speak at a hearing from your personal experience as a provider about why these sorts of bills are extremely detrimental and they hurt your ability to provide care.